Welcome, everyone. This webinar is being brought to you by Pineapple Support and their sponsors, choosing the type of therapy that's right for you. My name is Dr. Tess Kilwine, and I'm a clinical psychologist who provides individual therapy, group therapy, and webinars for Pineapple Support. Choosing the type of therapy that's right for you can be a daunting process. This webinar will discuss common evidence-based therapies for a variety of mental health and substance use disorders, including anxiety, depression, post-traumatic stress disorder, and eating disorders. Questions participants can pose to potential therapists to best understand the type of therapy they will receive will be presented, and cultural and identity-based considerations for therapy will also be incorporated throughout the webinar. These are things like accessing adult industry-affirming professionals. Participants will leave the webinar better understanding the types of therapy available to your unique presenting concerns so you can more confidently seek appropriate care. Welcome to choosing the type of therapy that's right for you. Let's get started. Throughout today's webinar on choosing the type of therapy that's right for you, we'll be discussing the purpose of therapy in general and how to assess your own personal unique needs for the therapy process. I'll present the different types of therapy available to clients and why a positive fit with your therapist matters most for therapy to be effective. Practical factors to consider with starting therapy will be considered, including aspects of therapy unique to the adult industry. Lastly, I'll finish up with some key points to leave the webinar with. So to start, what is the purpose of therapy? Why do we do it? Why does it exist? Why is it important? And essentially, the purpose of therapy is to help individuals identify and change troubling thoughts, emotions, and behaviors, ultimately aiming to improve your quality of life by providing things like coping mechanisms, developing new perspectives of situations in the world, and learning healthier ways to manage the challenges that present in our lives. Essentially, therapy is a process to gain relief from symptoms and enhance daily functioning through a supportive and non-judgmental environment with a trained professional. So often, we go to our friends, our partners, our coworkers with the challenges we're experiencing in our life, and the purpose of therapy is to create this sort of separate space that's solely yours, to process those concerns and get a different perspective from an unbiased person. So some of the key purposes of therapy are, addressing mental health concerns, of course. Therapy was originally designed to help with a wide range of issues and symptoms like depression, anxiety, relationship problems, trauma and stress, eating disorders, and substance use. So you don't necessarily have to have a mental health diagnosis to find therapy useful in your life. Many people that are navigating relationship challenges, grief and loss, major transitions in their life, like a new relationship or moving to another state or a new workplace, can find therapy just as helpful. So others use the space just to keep themselves accountable and keep growing and improving as a person. So of course, to address mental health concerns, but that doesn't necessarily mean you have to have a mental health diagnosis. I think that's an important point. Another purpose of therapy is to develop coping skills for those mental health concerns or things going on in your life. So therapists work with individuals to learn new strategies for managing difficult emotions and situations. Sometimes we've tried different strategies or things on our own, and going to therapy can provide some alternative coping skills you've maybe never considered before. So a lot of us have engaged in less than productive efforts to cope with stress. So things like substance use or self-harm or social isolation. And the purpose of therapy is really to identify and replace some of these unhelpful coping mechanisms with strategies and supports that are just as effective, but less harmful and hopefully beneficial to our overall health and well-being. Third is improving communication. So this is a big one. Therapy can really help people better understand their communication patterns in their relationships and develop ultimately healthier ways to interact with others. So these, again, might be our family relationships, our romantic relationships, or our coworkers, whoever it might be. So, this is really huge for people navigating challenges in their family systems or relationships or workplaces. Communication is often at the core of interpersonal challenges that present in therapy. And in my experience, one of the most common issues that presents in therapy, regardless of a person's reason for coming in. So you might be coming in for a mental health concern, but certainly like communication and relationship challenges are probably contributing to it or a result of those mental health concerns. Therapy essentially serves as like a sounding board to practice communication in ways that you hope to ultimately communicate in your personal life. So maybe you've been wanting to communicate something to someone in your life and you just don't know how or need some feedback on that. With your therapist can be a way to practice having that communication and different outcomes. Self-awareness is a big one. So through therapy, people can gain insight into, their own thoughts, feelings, and behaviors, leading to increased self-awareness and personal growth overall. So it's never that the therapist knows more about you than you do about yourself. I want to clarify that. But instead, the therapist can serve as sort of a guide for you to discover aspects of yourself that may not be at the forefront of your mind all the time. It's a different perspective. And sometimes this act of just saying something out loud to another person helps us resolve major questions about ourselves and our relationships and our lives. Therapy is this uniquely safe and confidential space to do that kind of self-awareness exploration that might not feel quite as safe or comfortable in our personal lives. And lastly, the purpose of therapy is to get this really personalized approach. The whole purpose of this webinar is choosing the type of therapy that's right for you because there are so many different styles and fit matters a lot. So many different types of therapy exist that we're going to discuss just in a moment, allowing a really tailored approach to each individual's needs and circumstances. It's very different from things like self-help guides or things that you might find online because therapists are specifically trained in conceptualizing each individual case and creating these really tailored treatment plans that best serve the unique needs of each person. So we don't approach each client as the same. We spend a lot of time thinking about conceptualizing treatment planning around each individual that we work with. Therapy is often the one and only place in people's lives that's dedicated solely to you as a person. So, this is the one place you get to and kind of need to be a little bit selfish and focus on yourself and your own journey. So that's what it's designed for. It's a dedicated space for you to do that work. All right, so now that we understand the purpose of therapy, how do you assess your own needs for therapy? Clearly, mental health is a really essential part of our overall well-being, just like physical health. And seeking therapy is a proactive step towards improving your emotional, psychological, and social health. Think of it like your preventative care visits at the doctor. You go to your doctor to check in and see if everything's functioning well. Same thing with therapy. However, with so many therapeutic approaches available, it can feel really overwhelming to choose the right approach, the right therapist, the right style. So this really idea is that you've got to understand and assess your own needs to make this process a little bit more easier and convenient and effective, right? If it's going to be effective, you really need to understand your needs and find the right fit. So a couple questions I encourage people to ask themselves when they're in the process of assessing their needs and what kind of therapeutic approach might be the best fit for them is one, what issues or symptoms are you experiencing? This might be things like anxiety, depression, trauma, eating concerns, relationship problems, life adjustment. So what really is the issue or the symptom that you're experiencing? Two, are you looking for short-term support or a long-term therapeutic relationship? So is this something you feel like you could resolve relatively quickly, like processing, a recent grief or adjustment in your life? Or is it something that's going to be more long-term, a childhood history of abuse, an ongoing relationship challenge? So asking yourself, is this something you feel like you can resolve relatively quickly or something you're going to need a long-term support around? Next, do you prefer individual therapy, group therapy, or couple or family counseling? This can be a tough one because sometimes you could benefit from multiple, and that's okay. Sometimes people do multiple. But asking yourself, like, what really is the root of the problem? Is this something within myself I need to resolve? Is it within my relationship dynamic we might need to go together? Would I benefit from being in a group of people with similar concerns, group therapy? Is family the issue? So you can always start in one place, and a therapist is going to do a pretty good job of saying, like, hey, maybe you need to add or switch to couples or group, but it might be helpful to assess your own needs of like, hey, group therapy is really what I need. I need a supportive space with other people with similar concerns. Skip the individual therapy, try group therapy. And lastly, are there specific outcomes you hope to achieve? So this might be asking yourself, do I just want to better understand myself in these things that I've been through? Or do I want something to change? Do I want to leave my workplace, leave my relationship, things like that? Do I want to reduce the frequency or quantity of these specific symptoms? So really asking yourself, maybe at the end of treatment, what would you want to look different? What would that outcome be? And that can help guide you in these conversations with therapists.
All right, so assessing your individual needs for therapy on the previous slide can help you determine the type of therapy that would be the best fit for you. So this isn't the individual, group, couple piece, it's actually specific modalities that might be presented in the individual therapy space, though you also find some of the stuff in the couples and the group as well, of course. So as mentioned, therapy is not a one size fit all. Different therapeutic approaches assess really different needs of clients. So what I'm going to do on the slide is name some common types of therapy, but really want to emphasize that this list is not exhaustive. It just can't be because of the volume of different modalities out there. So your best route to explore, different types of therapy and identifying what's right for you is through some of your own research of, therapist offerings online, and then actual conversations with those potential therapists. I will list here what tend to be sort of the maybe more common or larger subsets of therapy, and then there's certain types of therapy within each of these, but we'll do our best to cover what we can. Cognitive behavioral therapy, CBT. Most people have probably heard of this one at one point. This is one of the more common types of therapies out there and has long been considered evidence-based or first-line most effective for treatment of a variety of mental health conditions and symptoms. So when we're looking at the generalized anxiety, the major depression, the eating disorders, the substance use, the post-traumatic stress disorder, the OCD, those kind of things, CBT really is often the front line of that kind of work. CBT stands for cognitive behavioral therapy, right? So it recognizes that there is this intricate relation between our thoughts, our emotions, and our behaviors. They're intimately connected and often focusing on identifying and changing the negative thought patterns that result in negative emotions and behaviors. So we often look at it kind of a circle, right? You've got your thoughts up here, your emotions, and then your behaviors, and they're all related. So if you're thinking negatively, you're probably going to feel pretty negative and then act in ways that are maybe pretty negative, right? Maladaptive coping, isolating yourself from others. And when you engage in those behaviors, you're probably going to have more negative thoughts, right? Like, I'm no good, or I can't get out of this on my own, resulting in, more anxiety, depression, whatever it might be, and it just goes in that circle. So CBT can be used to treat a whole lot of mental health conditions and doesn't have to be just used on its own, right? You may be doing other types of work as well and incorporating CBT in it. Now, DBT, dialectical behavioral therapy, is a form of CBT that's particularly beneficial for things like intense emotional challenges, emotion dysregulation, interpersonal difficulties, things like that. It originally was found and primarily beneficial for borderline personality disorder, but that is not the only disorder that DBT can be effective for. Sometimes people will hear like, hey, you might benefit from DBT, and if you're familiar that that's used for borderline and that's not something that you experience, don't rule it out, because really any kind of intense emotional challenges that you experience in your life can be made better through practices of DBT skills. So the four components that are really emphasized in DBT are emotion regulation, distress tolerance, mindfulness, and interpersonal affective skills. So if any of those four resonate with you as something that might be beneficial, probably incorporating some level of DBT. It doesn't have to be the full course, right? But some skills and strategies could be beneficial for you. Another form of CBT is ACT, acceptance and commitment therapy. This one focuses a little bit more on accepting your thoughts and feelings without judgment rather than attempting to challenge or change those thoughts. So remember that wheel in the CBT, we want to change or normalize or whatever it is, some of our thoughts, like, hey, maybe it's not accurate or not helpful, so you feel better and act better. ACT recognizes that some of these thoughts and these core beliefs about ourselves might be true or might be so ingrained that they can't be challenged. And so it recognizes, we can't attempt to change all thoughts and feelings. Rather, we should accept some of those without judgment. And then really guides clients to actively commit to behaviors that align with their core values. So, yes, I may be thinking this way, and I can still move forward in my life in a way that's consistent with my values, live meaningful lives despite the challenges and discomforts that they might face. So personally, I often find myself using a combination of these three, CBT, DBT, and ACT, but especially when it comes to those really challenging thoughts, I might ask, like, is it possible to challenge or change that thought? Is it so unhelpful or so inaccurate that we really need to find a more productive thought for yourself? Or is acceptance more appropriate? Is it something that might hold a certain level of truth? Like we can't erase our histories or acts that we've done, right? So is it more appropriate to be able to accept that thought and continue to move forward in a value-based way in our lives? So really none of these treatments have to be used exclusively. You could pull from different modalities, which is why most therapists consider themselves something called integrated, integrating from different modalities. But there is often sometimes this camp that's like CBT is opposite of ACT because one challenges and one accepts. And I don't think that that always has to be the case. Next is psychodynamic therapy. So this is a therapy that's been around a really, really long time, was one of the first versions of therapy out there. And it really focuses on the deeper exploration of unconscious processes and past experiences, usually from childhood, to understand current behavior and emotional struggles. So most people find this therapy best suited for like deep self-reflection and long-term growth, as it's not really the goal of psychodynamic to change or challenge problematic thoughts, emotions, or behaviors. It's more focused kind of on the past things that we've been through and how they show up in our lives. Humanistic therapy is a type of therapy that focuses really heavily on self-actualization, becoming the best versions of ourselves, personal growth, achieving one's full potential in life and relationships, really centered on the human and being the best versions of humans we can be. So this type of therapy is most effective for those seeking non-directive, empathetic approaches to their current challenges. So maybe not really wanting to change a whole lot about yourself, not needing to change a whole lot about yourself, but wanting to just better understand yourself and engage in some self-growth. In contrast, these top three, CBT, DBT, and ACT, tend to be a little bit more directive and focused, and sometimes challenging and sometimes pushing you to face some truths about yourself. Though, of course, each of these therapies involves warm and collaborative components as well. Next, I want to touch base on the trauma-focused therapies. So these are treatments that get a lot of attention in the media. A number of evidence-based treatments are dedicated specifically to processing and healing from trauma. So they most commonly include a focus on, one, processing cognitions or thoughts related to the trauma, so how we think about ourselves and others in the world as a result of the trauma, or therapeutic exposure to gain more accurate memories of the trauma, regain control over the trauma, or some combination of both of them. So some version of cognitive processing, we've got to look at how our thoughts have been impacted by the trauma, and some level of therapeutic exposure, which is facing the memories of that experience so we can gain some agency and control over it. So really the most popular and common treatments that are considered evidence-based for trauma are cognitive processing therapy, focus heavily on, again, that cognitive processing of those thoughts piece, but includes exposure. Prolonged exposure therapy focuses a little bit more heavily on that exposure piece, but also involves processing. And then eye movement and desensitization therapy, or EMDR. What's really important to know is that, EMDR is really kind of popular and out there. That is not the only evidence-based treatment available for trauma. We have lots of evidence that cognitive processing therapy, prolonged exposure therapy, and even some other modalities like narrative exposure therapy and different things are just as effective. So if you're having trouble maybe financially or practically accessing something like EMDR, that is not the only trauma-focused therapy available to you. Now, just to touch on the group therapy and the couples and family therapy, within group therapy, you can use any of those modalities, right? So you can have any aspects of CBT, DBT, there's all these kind of things you can do in the group therapy. Same with couples therapy, like internal family systems or Gottman method, things like that. But I'm just going to touch on them more broadly for the purpose of the webinar. So, group therapy, type of therapy that is exactly how it sounds. So, it offers support and insight from peers facing similar challenges, often facilitated by a trained therapist, sometimes facilitated more by a peer, but that would be more of a support space than group therapy. It can sometimes be beneficial as a standalone, so only group therapy and not individual therapy on top of it based on your presenting concern or severity, but also is often used as an adjunct to individual therapy or a way to transition out of individual therapy. So you've completed individual therapy, you've done that work, and now transitioning to more of a group setting or peer-based setting is effective. So, maybe you've done that individual work and you're ready to challenge yourself socially and gain more support and perspective from peers. It's really up to you and your therapist and what you think is best for you. Group therapy can sometimes be a little bit more cost effective, maybe fewer sessions and reduced rate. Uh, Also can be really beneficial because you're around other people and having that experience. Individual therapy can sometimes feel more approachable, right? But you just got to decide what's best fit for you. And then last thing is our couples and our families therapy. So also exactly how these sound. These therapies focus on improving really communication is that big one, resolving conflicts within relationships and families. And, there are, as I mentioned, specific modalities and approaches that therapists may take in the couple or family therapy, like Gottman method and internal family systems are two really common ones. So what I encourage people to do is ask those questions about specific approaches when considering a couple, family, or a group therapist, right? Of like, what types of therapy modalities and theories do you draw from in the group therapy and couples therapy space, and how do you find that beneficial for that specific type of therapy? You're going to hear this more than once throughout the webinar, but ask questions is a big thing of like, you are not expected to be the expert on all these different types of therapies and offerings, but you do have a right to get accurate answers from your therapist about how do they practice, what kind of benefits do they see with specific presenting problems. So I hope this gives you just a foundation of like, if someone says, hey, I'm a CBT therapist, you at least know what that means, right? That's a pretty directive approach that's focused on thoughts, emotions, behaviors.
So, in recognition that many of us are visual learners, here is a graph, an image that sort of breaks down the different types of therapies I discussed on the previous slide. So, the horizontal axis, if you go across, is really our non-directive approaches. So, the client is kind of in charge and leads it. Across to our directive approaches, where the therapist is a little bit more active in that space. If you look at the vertical axis, so up and down, that represents a focus on like the current and future on the top, all the way down to a focus more on the past and things on our history. For example, if we look up at the top right corner, you will see the solution-focused therapy and the cognitive behavioral therapy. We talked about cognitive behavioral therapy. Solution-focused therapy is kind of a more short-term, really focused treatment on there is a problem that I want to solve. There is something that I need to change. So it got some similarities with CBT. It's pretty directive. It's really focused on the current and the future. So that one's up there. It can be a great approach for like time sensitive things, like I need to make this decision in this amount of time, things like that. So both those treatments up in that corner tend to be the ones that are more directive, right? The therapist is leading, can be a little bit more challenging, and they focus on how do we resolve things in the current moment or in the future. Now, if we look at the left side, over in the more non-directive approaches, we talked about humanistic. So that was that focus on, being the best version of yourself, self-actualizing, being a human, right? Person-centered, really a similar type of thing. So really focused on the person and benefiting and growth of that person and self-actualization. So these type of approaches, if you can see, they're the non-directive ones, right? So this is where, the client is really kind of in charge of what they want to discuss and change, if anything. And then they're still, focused on the present and the future. Whereas if you go down, you're going to see the ones that are a little bit more focused on the past, right? So psychodynamic is that big one that we talked about that's been around for a long time. Tends to really heavily focus on the past, the things we've been through maybe in our childhood and our early development and relationships. And it's kind of in between in terms of non-directive and directive. So The therapist is going to be directive at times when appropriate, and then the client leads when appropriate, but the emphasis here is that it's really focused on the past. Now, like I said, we've got this big bubble in the middle here called integrative, and this is most therapists that you're going to come across, right? They might pull from a range of approaches that best fit the client's unique needs at the time. So sometimes we need that person-centered, non-directive approach if someone just needs to be heard and needs to be understood. And then sometimes we need that more solution-focused and CBT approach where like, no, I actually need some solutions and to make a change in my life. Key here is, again, some folks might sort of jump around a little bit, but you will find most therapists are able to identify in some regard of what's their foundation, right? So my foundation is in this person-centered humanistic, my foundation is in CBT, my foundation is in psychodynamic. So hopefully this gives you a little bit of idea of what that looks like. Oh, I should also note, if you're not seeing something on here, that's because there's no way to put every type of therapy on the slide, but these are some of our bigger ones that we might find. Okay, now that I just spent 10 minutes telling you how important it is to assess your needs and pick the right modality for you, I'm actually going to emphasize this point that, it's important to understand the therapeutic approaches available to you that might best fit your needs, but fit matters most. Fit with your therapist. So all the research we have on therapeutic approaches demonstrates that the therapeutic relationship itself is the most important factor in determining the efficacy of therapy. So no amount of evidence-based therapy is going to be effective if you don't trust or feel comfortable with your therapist. So fit may not be enough, right? It may not be everything, but nothing else is really going to work unless you have that first fit with a therapist, if that makes sense. So what I tell people to ask themselves, maybe you're doing an initial phone consultation to assess the right therapist. You've been working with your therapist for a while and haven't really seen the type of change that you want to. You've got to ask yourself some questions. Do you feel heard and understood? Did the therapist approach resonate with you in your presenting problem? And were you comfortable discussing personal issues? I cannot tell you how many times I've gotten a client from someone else and they didn't disclose some really important aspects of their identity or their experience because they didn't know that they could in that space. They didn't feel maybe heard or it wasn't welcomed in the space. And so you got to ask yourself, like, if you're hesitant to talk to your therapist about these things that are impacting you, it might be time to ask about that fit, right? So a couple of key things I tell people to do in assessing fit is take advantage of those free consultations. So many independent therapists offer free 15-minute phone calls so you can ask questions and whether they'd be a good fit for you. A good therapist is going to welcome these questions. They're not going to shoot them down. They're going to be open to discussing whether their approach meets your needs. Therapists understand that they are not the best fit for every client. That's why we offer these consults. The next is be open to change. As you grow and evolve in therapy, your needs and unique needs might shift as well. So you might start with one type of therapy or therapist and find that another becomes more relevant over time. So maybe a different modality is more appropriate for you later or a different therapist altogether. Your therapist themselves might actually be the one to recommend a referral at some point to a different type of work. It can be difficult to leave a therapist that you have really grown close to or done some transformative work with, but sometimes that really is the best direction to continue growing as a person. In addition to fit, we've got the specific therapy approaches, overall fit with your therapist. There's also some really important practical factors to consider. So good therapy is a commitment of time, energy, and finances. And as I mentioned, a good therapist is going to welcome questions about these practical factors to determine if they're the right fit for you. So if the fee is causing more stress in your life than therapy can resolve, maybe you got to look elsewhere for a different fee. If, having to go in person is really difficult for you because of childcare or work, maybe virtual is actually a better fit for you, right? So these kind of questions therapists are going to answer for you so you know who's going to be the best fit. One is cost and insurance coverage. Check whether your insurance covers mental health services, either in network, meaning you pay that small copay, 5, 10, 15, and insurance covers the rest, or out of network, where you pay for those services up front and then a portion or percentage is reimbursed for you. This is tough. to keep in mind that many good therapists, especially very specialized therapists and things like trauma and eating disorders and things like that, might be out of network because the insurance industry it really isn't great at compensating therapists for their work. So if you need to look in network for financial reasons, you're still going to find some great therapists, right? But if you have the ability to explore outside of your in network, you may actually find someone that could be a better fit. So be willing to ask for other things from those out of network therapists. Do they offer documentation for out of network reimbursement so you can get reimbursed by insurance? Do they offer a sliding scale based on your income? Do they offer reduced costs of sessions for you? Or do they offer payment plans? So, in network, of course, is probably going to be covered the most through insurance, but based on fit and other practical things for you, you might consider someone who's out of network and ask some of these questions. Therapy is also a qualified health savings account service, just so you're aware. So maybe you got that, but it's not covered in your insurance. You can use your HSA for therapy. Next thing to consider is availability and accessibility. Look for therapists that have appointment times that fit your schedule. You may work full time and you can't meet during the day. That might mean you have to look for a therapist with evening or weekend availability, and they do exist. There are therapists that recognize the unique schedules of clients. You also want to look at whether they offer in-person, virtual, or hybrid sessions, meaning a combination of the two. So sometimes you go in person, sometimes you go virtually. Again, many good therapists and even specialized therapists might only be accessible virtually. This may be even more true for adult industry performers. One of these reasons is some therapists that work virtually are actually located in different states that you are. And maybe you're in a smaller state that doesn't have a lot of folks that specialize in maybe your career or your unique identities. You can access virtual providers from other locations that might actually be a better fit. So it's changed a lot in that in-person therapy is actually not really the standard anymore. There's a combination of the two just based on practical factors, fit, presenting concern, things like that. Cultural competence. So if it's important to you, find a therapist who understands your unique cultural background, identity, or lived experiences. So these are things like considering whether that therapist has taken the time to demonstrate their cultural competency, humility, or affirmation in their marketing materials. Do they say, hey, this is an area of training and expertise in? And then being willing to ask that therapist directly, what is their experience working with clients of that particular culture? How might you modify existing approaches to serve identity-based needs? These are certainly questions that therapists welcome, and if they're not willing to answer them, may not be the most culturally competent, right? And may not be the best fit for you. Last thing is therapist credentials. So ensure that your therapist is licensed first. There's a lot of things out there like coaching, right? And coaching has its place, but coaching is not therapy. So if you have mental health concerns you're wanting to work on, you are looking for licensed mental health providers that are trained in therapeutic approaches that are best for your need. So lots of different titles out there that don't require the actual license. So ask them to share things like, what is your specific license? What is your specific training or credentials in certain modalities? Like, let's say you're looking for DBT. Ask them, do you have specific training in DBT? Evidence-based treatments for trauma and PTSD. Ask them, what do you offer? What kind of training? Things like that. Again, good therapists are going to welcome these questions. Okay, so on that note of cultural competency, practical considerations is therapy in the adult industry. So as with all of my webinars, I want to take a moment to focus specifically on therapy in this industry. So therapy for individuals working in the adult industry as performers, as promoters, as producers, anyone, can be influenced by a variety of unique factors related to this profession, the personal life, societal perceptions. So these are just some key considerations for therapy within this context. One is a non-judgmental approach is key. It is important that therapists approach clients without judgment regarding their work in the adult industry. This non-judgmental stance really fosters things like trust and safety and openness necessary to do therapeutic work. So what I mentioned previously, if you find yourself not wanting to disclose certain aspects of what you're going through in your personal life, with your therapist, they may not be the best fit for you, right? If they haven't intentionally created that non-judgmental space for you. So if you experience any judgment at any point in your work with a therapist or find yourself not disclosing parts of your work or yourself out of fear of judgment, it's likely that either A, you need to bring that up to them and have that conversation directly, or that they're not the right fit for you, right? So if otherwise they seem like a really good fit, give that feedback to that therapist. They may be willing to change, or maybe they had a blind spot and they could still be a good fit for you. Or based on maybe the response you get, it might be a good idea to switch overall. Confidentiality concerns, it's not uncommon for clients to worry about their privacy due to the stigma attached to their profession. So therapists who are qualified to work with adult educated populations will emphasize things like confidentiality and address any fears that you have about disclosure, where information goes where, and things like that. So things like they won't look you up online, and if they do, you have a right to be concerned about the ethics of that therapist. If you're sharing content for any kind of therapeutic reason, or your name is on your Zoom account or things like that, that's one thing. But if your therapist goes out of the way to search you online and find your content, there's really no reason for that, and you should be concerned if it happens. Stigma and societal judgment. So the stigma, unfortunately, around the adult industry can affect things like self-esteem, relationships, and social interactions. And therapists who are trained to work in this profession should create a space in the therapy room for clients to explore these factors, how they impact mental health and well-being. So some of the actual strategies therapists might work on is building self-esteem, resilience, and strong social support networks can really be emphasized in therapy with adult industry entertainers. Boundaries and consent. I find a way to incorporate this into every webinar I have in the adult industry. This is a big one because of the unique, intimate dynamics at play in both personal and professional lives of adult industry performers. Clients may need support in navigating personal boundaries with their family members or their romantic relationships, but also professional boundaries with their colleagues and the people that we're working with. So in therapy, this might look like helping clients strengthen their skills in communicating with people in their life, setting and maintaining boundaries, and managing power dynamics present in the industry. On a similar note, when it comes to trauma and safety, the adult industry does pose unique risks for things like workplace harassment, exploitation, and trauma, which should be considered in therapeutic goals, right? So therapists working in this area should be trained in at least one formative evidence-based approach for trauma, or be very clear that trauma-focused work is not what they provide, right? If they are not trained in some type of evidence-based approach for trauma, then it's probably best to refer you to someone who can do that work. And I would hope that the therapist does that for you rather than not disclosing. Relationships and intimacy really at the core of the adult industry. Many entertainers experience difficulties in personal relationships due to the nature of their work. So therapy could offer a space for clients to learn to navigate the communication and trust and intimacy within their romantic relationships, friendships, families, as they are balancing their work in the industry as well. A little bit about substance use. We do find elevated rates of substance use, specifically as a coping mechanism in the adult industry. So it would certainly be helpful for therapists who work in this area to be trained to, at a minimum, accurately assess for substance use concerns and then provide appropriate interventions if trained, or referrals if not. And so needing to ask about that, how do you cope with the stress of daily life? And is that ever in the form of overuse of alcohol or drugs? Career transitions, another common aspect that we might find among performers is that at any point in the therapeutic work with an adult entertainer, producer, whoever it might be, clients might want to transition out of the industry altogether or explore alternative careers within the industry, going from a performer to a producer. That's not uncommon, things like that. So being able to offer some level of career counseling, resources for skill development, and planning is warranted. So, most therapists are not also career counselors, but having just a little bit of familiarity in how to do that work with clients. All right, intersectionality, the big one. So many individuals in the adult entertainment industry face overlapping challenges related to not just their career, but their identities, race, gender, sexuality, socioeconomic status. So it's important that therapists working with this population have high levels of cultural competence, like I discussed on the last slide. Really needing to understand how these identities interact with the profession and mental health to provide that space for therapy where, none of your identities are left at the door. You and who you are as a person and a professional are all welcome in that space. Sexual health and wellness. Some clients might need some support navigating sexual health concerns via education or referrals in collaboration with healthcare providers. to ensure comprehensive care may be warranted. So, having some familiar with sexual health and wellness and then resources available to clients can be beneficial for the individual therapist. And lastly, therapist training. So ultimately, it's important that therapists working with this population or wanting to work with this population seek specialized knowledge and training on the unique experiences in the individuals that are working in the industry. Adult entertainers should not be teaching therapists about their lives and their unique concerns, right? Some level, sure, but therapists have a responsibility to understand what it's like to work in the adult industry so clients don't spend their whole time kind of coaching you or teaching you, and you can get right down to business. So continuous learning is really important. Therapists should stay informed about the challenges and cultural nuances relevant to this field so clients themselves aren't the ones, again, constantly educating their therapists. So, by understanding these factors, therapists can provide a supportive, non-judgmental, and effective therapeutic environment tailored to the unique needs of individuals in the adult industry. Okay, and to take us home, a few key takeaways. Thank you for your time to tune in today. I'm going to leave you with a few key takeaways on choosing the therapy that's right for you. So one, choosing the mental health therapy is a personal and an evolving journey. This is one of those things where there really is no size fits all. So just because your therapist worked with your friend or your colleague does not necessarily mean that they'll work equally well for you, or they might. It just depends on your needs. Number two is be curious by really understanding your unique needs, exploring the variety of options that are out there, and prioritizing that strong therapeutic relationship and fit with your therapist. You can find that therapeutic path that best supports your well-being. Taking your first step, remember that doing this is already a courageous and transformative decision. So, research actually shows that a whole lot of change within ourselves and our mindset happens for us just between the decision to start therapy and the first couple of sessions, right? So, even making that initial call, attending the first couple sessions can be really impactful. So, if you don't find that, it's something you do long term or something you need long term, you probably still have a whole lot of benefits from it. And lastly, you can change your mind. If a therapist is not a good fit, that's arguably the most important aspect, and you can change providers. It's also possible that the therapist was a good fit for you at one time based on one presenting problem or where you were at in your life, and then they're not the right fit for you in a future presenting problem or time in your life. So be open to trying someone new, referrals, things like that. And that is it for today's webinar on choosing the therapy that's right for you. I hope you learned a little bit about how you might approach seeking a therapist in your future or taking a look at your current therapeutic relationship and conversations you might want to have or changes there. Again, this webinar was brought to you by Pineapple Support and their sponsors, and my name is Dr. Tess Kilwine, one of the Pineapple Support therapists. Take care.